Hi guys, welcome to this session of Beyond the Knife Candid Conversations. I'm Nikhil Panse, and as you all know, in this session, we try to discuss the non academic aspects of plastic surgery because during conferences, this part is greatly neglected. And we have seniors, teachers, and people in the field of plastic surgery who are excelling in other aspects as well as curricular things that we tend to discuss over here. So in our today's session of Beyond the Knife Candid Conversations, we have with us Dr. Sunil Keswani, sir. He needs no introduction. He is the skin bank man of India. I think all of us plastic surgeons in India have visited National Burn Center at some point or the other. He has helped in establishing multiple skin banks across India. His Operation Restore is going year after year very successfully, and many young surgeons are being trained over there. So, welcome Sunil sir, and thank you for coming on this session of Candid Conversations.
Thank you, Nikhil. It's always a pleasure to interact with you. You've always been a source of inspiration to me, though you are junior to me. Inspiration can come from all kinds of sources. So seniority, juniority goes for a toss once you've passed your degree or come into practice, and we're all on level playing ground. So once again, thank you for having me here.
Thank you, sir. Sir, coming to the topic, which obviously I'll be questioning you today, mainly about skin banks. So we'll begin with that one. So you have been instrumental in establishing multiple skin banks across India, yet the outcomes have not been very satisfactory. Many skin banks tend to close down. Many skin banks don't get that amount of donors which we hope they would get. So what do you think is the main reason for this? Are we ahead of time, or there are a lot of issues which need to be addressed?
Essentially, Nikhil, I think the man who was ahead of time was my father, Dr. Sunil Keswani, who started the first skin bank in the year 1978 in Wadia Children's Hospital. He had all the facilities. He has freeze rank facilities. He had liquid nitrogen tanks. He had carbon dioxide snow. He had everything. He set it up, and the bank didn't work. He tried for 2 to 3 years along with Dr. Vartak, and it didn't work. And ultimately, he closed down and just sat over it. And ultimately, the onus came on Dr. Madhuri Gore at Sion Hospital in 2000. She started a skin bank with the cryo technique.
Yes.
The cryo technique is something which is very expensive, and skin cannot be transferred with the cryo technique from one city to the other. It's very cumbersome, expensive, and non-feasible for Indian population. So then, coincidentally, on a visit to Europe with my wife, we visited we were in Amsterdam, and I suddenly saw the name of Beverwick on the train map when we were at the station studying where to go on a particular day. And I found Beverwick there. Remembered my father had told me there is a Euro tissue bank there. And he had told me that we must have a bank like the Euro tissue bank where there's a glycerol technique, which is easier, simple, inexpensive, and ideal for a country like India. So we took a train for half an hour, went there and saw the procedure and found it very good. And coincidentally, again, there are a lot of coincidences here. Coincidentally, the director of the skin bank there was of Indian origin. 4 generations ahead, his great grandfather had been taken as a slave to Suriname, which was a Dutch colony, from Bihar. And he was happy to meet us, and he said, I want to come to India, but I cannot give you permission to start a skin bank, nor can we share protocols and SOPs unless I personally come and see at what level you are. Then he came down, he was happy that we had a facility, he was happy that he was surprised, in fact, pleasantly surprised. So, and that's how the whole thing started. Now, but we are not ahead of time. We are just at the right time, at the right place. Skin banking has been there in the world for the last 50 years. In fact, the first skin bank was started in the Naval Hospital at Bethesda in America in the 1950s.
Right.
So it's 1950, then in 2026, 76 years is enough time for a technology to come from the west to the east. Now, with globalization, it's in 6 months, everything comes from there to here. So I think the right time the skin bank started. Dr. Madhuri Gore set the ball rolling. In 2009, we set up a skin bank with the glycerol technique, not the cryo technique. And we have gone on setting up banks. Today, we have 36 skin banks, of which 22 National Burn Center and Rotary Club of Bombay North have been instrumental in setting up these banks. Now, the problem with, of all these banks, all banks are except for 2, but then which had to close down for certain logistic reasons. But by and large, you rightly mentioned that the number of donations which come through are not enough. When I say enough, they're not enough to keep the skin banks viable. A certain number of donations have to happen to look after the economics of skin banking. So, though nothing is charged from the patient for harvesting, or nothing is charged from the recipient while giving, there is a certain amount of processing fee which is levied, which just looks after the incidental expenses of running the bank, so that it's self-sustaining. So the problem is why it's not happening. The number of donations are not there. Is not that people do not want to donate. We have failed in creating the awareness that skin is also an organ which can be donated. So that the failure is on our part. So the banks which have not done well are purely because they do not get enough donation, because they have not worked hard enough to create awareness in that particular area. In Mumbai, for instance, we have been active. We conduct about 100 to 150 awareness programs for skin donation, minimum, maybe more sometimes, by linking up and with about 10 NGOs. We've linked up with Rotary, which has got 127 clubs in our district here, and the adjoining district, another 100 clubs, 210 clubs. And also with the Lions Club, Giants. So I think when you do a combined approach and carry people together, only then can you create awareness. We do not have too many funds, and the government on its part has not done too much. We must have to accept that the government to a certain extent has to take the blame for not creating awareness. They create awareness for solid organs like liver, kidney, spleen. Then they advertise the green corridor and they make it very dramatic that the heart and kidney came from Jamnagar and then it went to Pune or Bombay. The kidney went to Bombay and the liver went to Bangalore. But I don't know how many of us doctors also know that for solid organ donation to happen, the patient has to be brain dead on a ventilator. You cannot take solid organs from a patient who's completely dead, where the heart has ceased to beat. So that means 99.99% of us can donate only tissues, that is skin and eyes. So that awareness has to be created. The focus has to shift from solid organs to tissues, because 99.99% of us will be able to donate skin and eyes only when we have a normal natural death at home. Again, we don't have that many ventilators for people to die on ventilators. So this organ donation will not happen to that extent. Skin and eye, anybody can donate. So with 1.48 billion population, even if 0.1% of our Indians start donating organs, including tissues, that is, skin unfortunately comes under tissues according to the Human Organ Transplant Act, we'll have enough tissues and organs not only for our own use, but also to export to other countries. So I think the problem is with us. It's not, we are not ahead of behind. And the only way today, as you know, Nikhil, you're running a department of plastic surgery along with Dr. Parag Sahasrabudhe, and you have a big burns unit. The only way to save major burns today is early excision, where you to remove the dead tissue within the first 48 to 72 hours, which is the golden period, and resurface it with allograft, that is cadaveric skin from a skin bank. In the absence of skin banks, this early excision will not be possible, and saving major burns will not be possible. So I think we are doing reasonably well, and we get about 20 donations a month, which is not too bad.
Yeah. But what about, not everyone is that proactive in conducting awareness programs. Maybe there are resource limitations and other things which are beyond our control. What do you think about legislation? Can legislation help in this?
Yes.
Part of it. And can we as individuals, as an association, do something actively to put this legislation into force?
Absolutely, Nikhil. Now you hit the nail on the head. That is the only way out for a country like India. Now, there are two ways that you can do an organ or tissue donation. There is the opt-in concept and the opt-out concept. The opt-in concept is what India follows and major countries follow, wherein if you want to donate an organ or a skin, you have to opt in. That means you have to opt in for donating by signing a pledge form. Or your next of kin have to opt in. That means they have to sign a form to express their willingness to donate. So that means the onus is on the person to take the lead and be proactive and donate. Whereas in certain countries like Spain, it is the opt-out system. Moment you are born in Spain or in a country where the opt-out system exists, you are deemed to be a donor.
Yes.
So if you don't want to donate, you have to opt out of the system. So by and large, most people donate. That's why Spain has the highest organ donation rate, which is 45 per million population, and India 0.5. Where is 45 and 0.5? In the last 3 years, it has seen a jump from 0.5. It has become 2.5. But where is 2.5 per million population, 45 million population? So I think the legislation has to come in if you want to save more and more patients. And as you know, it's not just burn patients who survive because of cadaveric skin or from skin bank. Degloving injuries, with faster cars, highways, you need degloving injuries ke liye skin to cover primarily till the wound cleans up, and then you can do definitive resurfacing. For pressure sores, for any non-healing ulcer, and even for skin diseases like toxic epidermal necrolysis syndrome or Sjogren's syndrome, which occupies involves more than 30% of body surface area, where this is the ideal thing to apply, and the skin heals beautifully automatically. It's a self-limiting disease. So I think it's a lifesaver, and if you have to save lives, we have to have legislation.
Yeah. Now, coming to establishing a burn unit, sir, because this is a question which is often there in the minds of young plastic surgeons. Now, these days, not many young people are venturing into burns actively by choice. But there are a certain group of individuals, certain plastic surgeons who want to establish their own hospitals or burn units. So, do you think it is financially viable, and how do they proceed with it? Are they on the right track when one wants to establish a standalone burn unit?
Yes. Nikhil, anybody who wants to start a burn unit must first of all understand that burn management is labor intensive. You alone may be a fantastic plastic surgeon with all the technical know-how of grafting, resurfacing. You may know everything about critical care management, but you alone are useless. This is a team approach. Unlike cosmetic surgery, where you alone can, with a very simple nurse assistant, you can do a major surgery like a breast implant or a rhinoplasty, with somebody just retracts and you are expert. You're not dependent on assistance for good outcomes. In burns, every member of the team, whether it's a nurse who's the base of the pyramid, she has to be a very good critically trained nurse. You have to have a physiotherapist who round the clock does chest physiotherapy to prevent hypostatic pneumonia, so the patient doesn't go into sepsis. You have to have a good microbiologist who tells you what organisms are growing on the body, so that you can do targeted antibiotic therapy as and when required. You need a nutritionist. It's a whole team that is required. So before you start off, it's a big amount of financial investment that you have to do. So when you want to set up a burn unit, it has to be an ideal burn unit. You cannot set up मैं छोटा सा burn unit बना था नहीं, but छोटा सा burn unit या बड़ा सा burn unit requires all the infrastructure. So it's more viable to build a bigger burn unit, because the larger number of patients will bring in work for all these people whom you employ, and these cannot be part-time. You have to have full-time physiotherapists round the clock. We have night-time physiotherapy happening at National Burn Center. That's why outcomes are better. And many people don't know that the maximum cause of death in burns is not burn wound sepsis. First is central venous catheter related sepsis, and second is pneumonias.
Yeah.
Pneumonias because patient cannot take deep breaths. There is atelectasis and pneumonia because of no deep breathing. That's where the chest physiotherapy or respiratory therapist comes in. So the young plastic surgeon who wants to set up a burn unit, a standalone one will not work. It has to be in conjunction with a bigger hospital where all the facilities already exist.
Yes.
And we can then bank on those facilities where everybody will be kept busy, and then only can set up. Now, talking of financial viability, today insurance has percolated down to the lower middle class also, and the factory worker also has a minimum insurance of about 3 to 5 lakhs. Not enough, but coupled with some schemes which are there, the MPJY scheme and Jyotibai Phule scheme and other schemes, different states have different schemes. It becomes financially viable very, very easily. Today, National Burn Center is doing extremely well, not because of getting more patients or something like that, but because the average patient, which earlier would not pay anything, now can pay 3 to 5 lakhs. And there are philanthropic organizations like Dorabji Tata Trust, Mahalakshmi Trust and other trusts. We give another 3 to 5 lakhs. So about 10, 12 lakhs mil hi jata hai. And then some amount of philanthropy has to happen for the poorer patient, which is easy to do. because there are the whole lot of burns which are happening are industrial burns.
Yes.
So where the companies pay for their workers very easily. So the whole epidemiology of burns has changed. Dowry deaths are not happening anymore. The women are not getting burned. Good news for women and men, because I think the women are now become useful members of society. They are earning more, sometimes more than their husbands. So nobody wants to burn them. Nobody wants to kill a golden goose.
Yes.
And this social change has dramatically changed the kind of patients get admitted. So in a burns unit or any burns unit, not in our any burns unit, you will vouch for it. You get now earlier burns units used to be full of women screaming, crying, usne jala diya, isne acid dala. Not anymore. Now you see industrial burns, all young men who are getting admitted or children. The children with scarred burns are
yes.
And the elderly people are coming in, elderly women who have poor reflexes while doing puja, they get burnt. Or you get burns during Diwali, your nice, beautiful flowing sari and gagras that you wear, the floor level diyas lying on the floor, that's where you get burnt. So by and large, things have changed grossly, and burns is financially viable and fairly lucrative. Agreed, for the amount of effort you put in, not as lucrative. So still cosmetic surgery beats it hands down. You do a cosmetic surgery and you get your money, and the outcome is predictable. Burns में इतना सब करने के बाद patient may still die of pulmonary embolism, deep vein thrombosis on this 56th day. So the unpredictable element and the long duration of continuous sustained effort and a team. You can't, one plastic surgeon cannot treat a burns. You have to have 2-3 people, because you have to sleep sometime and somebody has to look after. And ideally, the plastic surgeon himself has to pass his critical care board, because the wound dictates whether the patient becomes critical or not. And you have to correlate the wound with the clinical condition. So an outside intensive sitting in the ICU cannot figure out what is happening. So like abroad, Tina Parmeri had come from Cincinnati at the last APBC conference, and she mentioned they handle their burns. And here I have been attending critical care meetings every year. I alternate year, Best of Brussels in Pune, Dr. Shirish Prayag and Shubhal Dikshit, and alternate year, the ISCCM, which is the annual meeting of the Critical Care Society. We even train up nurses for critical care medicine. So we have been training up people also in all fields of burns. We'll come to that later, I guess.
Right. But having said that, how do you see the future of burn surgery? Because it is maybe not that lucrative as other subspecialties of plastic surgery. It is labor intensive, as you said. The outcomes are unpredictable at times. And in spite of all these, or rather in addition to all this, not many young plastic surgeons are venturing by choice into burns. So what do you think is the future of burn surgery?
Burn surgery is fairly algorithmic. Once you get into it and you have a team there, it is mathematical. And it's fantastic. It's very challenging, and there's a lot of satisfaction when you save a patient, because you make out a patient, is he well hydrated or not well hydrated? Is it hypovolemia or not very? Earlier there was a problem, urine output kyun nahi aa raha? So now you know that you look at lactates, you look at base deficit, you look at hematocrit. These three tell you whether the patient is hydrated. Not CVP. CVP is a wrong indicator. CVP is an erroneous indicator in critical care in burns today. So there are tricks and pearls out there, and it's very, very simple. But standalone, I mean, I myself, I don't do burns alone.
Yes.
You have to have a similar parallel subspecialty, like I do cosmetic surgery. Now, cosmetic surgery diverts me from the monotony of burns, because burns is fairly monotonous. There is grafting, there's critical care. And I enjoy critical care. That's why I am in it, because you understand physiology. And you have to have you can either do cosmetic surgery, or you can do reconstructive surgery, or you can do diabetic foot surgery, or you can do hand surgery along with burns. So one, the boring part of burns goes away, the monotony goes away. Two, you are earning enough there to be able to invest here. So burns, if you're going into burns as only a lucrative, it's not lucrative. The word lucrative is not. It's a service that you're providing, but there's a thrill of saving lives. And once you get into burns, speak to any burn surgeon, they'll say, "Boss, बहुत उसमें शांति मिलती है." And we have gone beyond that. We are not only saving lives, as you rightly mentioned. We do Operation Restore, where the patient who survive these burns, their deformities are corrected free with the help of rotary. Then we have got Mission Asra, where not only we correct the deformity is being corrected, unko jobs kaun dega? We have started Mission Asra again through Rotary, where we give them jobs. We get vocational guidance and vocational help for these patients. So I think the thrill is to go beyond, and it's exciting to do it because you establish more resources. You get resources. They're unlimited. Let me tell you, there are unlimited resources available in the market. The people who want to give, they're looking for projects. You should do one or two projects with them. Your credibility is established. You won't believe it. All that I need to do is make a project proposal, give it to Rotary. Within a month, I get any amount of money. For Operation Restore, we got 3 crores for doing 300 surgeries.
Right.
And we get it again. So earlier I had to hunt for money. Each time I had to go to club, मेरे को 30,000 per surgery का दो. And in Operation Restore, we not only do in 30,000 what the surgery, post-op care for a lifetime is free in the 30,000.
Oh.
It's not just the surgery. वो patient का अलग फाइल बनता है, वो फाइल से patient आता है, उसको बिलिंग काउंटर पे नहीं जाना पड़ता है. सिर्फ वो 3 हफ्ते के लिए नहीं, for a lifetime. So the thrill of doing, at the same time you're earning in your cosmetic surgery or in your, so this has to be along with the team. You have another 1 or 2 partners who help you out. So when you're doing that, somebody else is doing the burns part of it. And burns, once you establish a team, it's very easy to handle today in the days of WhatsApp, video calling. Reports keep streaming in every 2 hourly. Patient ka videos are coming, how the patient is breathing. Patient ka ventilator requirements are coming. Patient's ABG reports are coming. So microbiological reports are coming. So even if you're operating in another hospital, in between surgery, while you're having your coffee, you can quickly browse through the reports and give inputs to your resident doctors or nurses what to do. So today, treating critical care is very easy. Again, in the middle of the night, the surgeon doesn't have to go to the burns ward.
Right.
You can do a video conference call. Wounds dikha do mere ko. You see the video as if you're standing there. Parameters batao, report batao, and you tell them itna fluid chalu karo, catheter dal do, ye karo, wo karo, and even with their relatives, you make a conference call and talk to them. Ki main subah ko aake dekhta hu. I will be there. Treatment has already been instituted. This is the prognosis.
Right. So you talked about, I have been a part of many Operation Restores, and Rotary is an integral part of each and every Operation Restore. Even you, in my initial phases, you had categorically advised me that be a part of Rotary or Lions Club or be attached to some of these NGOs. So how do you think this helps us professionally? I mean, for youngsters who are venturing into practice, to be a part of Rotary or other NGOs, and what steps should the younger generation of plastic surgeons do actively to be a part of these things?
Right. See, of all the NGOs, Rotary is the one with the maximum amount of funding available at its head office at a place called Evanston in Chicago in the USA. And it has unlimited funds. When I say unlimited, genuinely, you ask for it and you'll get it so long as you show that how you're going to do it, the methodology of the project. You have to say what are the beneficiaries, and you have to show that the project is going to benefit a lot of people and is self-sustaining. And you'll do it year after year. ऐसे नहीं कि it's one off. You start this year and next year वो camp होएगा ही नहीं. या तुमने camp किया और post-op care नहीं है. So that kind of a thing. So once they see you for a couple of years, you get funding. Year after year, you get renewed funding. Second time and third time, the renewals are easy. The first time, the proposal goes through a whole lot of screening and surveillance, and they take interviews and all that. So that becomes a little bit of a issue, but initially. So that's one part. Funding is one part. And any project with a plastic surgeon wants to do, he can get funding for it. And plastic surgeons are one of the specialties where you can do a lot of free surgery. Like Operation Smile, unlimited number of cleft lip palate surgeries are going on.
Yes.
Which other subspecialty, surgical subspecialty, tell me, are doing so much free work? I doubt, because plastic surgeons are the one who do maximum charity. Burns, most of the burns patients are not that paying. Yes, company patients are paying, then you offset the losses that you incur while doing a free patient or a poor patient. And enough number of company patients, enough number of insurance patients are coming. The other benefit of joining Rotary for a youngster especially is, it gives you a place for network. You can show your skills, you can give talks. And Rotary ka beauty is that if you are a member of one club in a particular district, like in Bombay, there are 124 clubs. You can go to all the 124 clubs on different days and give talks.
Okay.
You can market your skills, you can market your profession, you can market what all you can do. So gives you an avenue for marketing your skills and educate people कि हम ये भी कर सकते हैं. You know, we have this plastic surgical day which you actively participate in and promote. What do? We tell the lay people कि हम ये करते हैं, हम ये कर सकते हैं और ये हम दूसरों से अच्छा करते हैं. So this is the area of core. So Rotary gives you that opportunity. Also, Rotary gives you a diversion. Otherwise, you are doctors. Many doctors marry other doctors. Their wives are doctors. Their sons are doctors. Sometimes their parents are doctors. Like in my case, and discussions at dinner table are about interesting cases rather than about some movie or an outing or a travel or a place. You know. So to divert myself from it, I joined Rotary so that I have some non-doctor friends. I had none. My cousins are doctors, my uncles are doctors, my father was a doctor, my wife is a doctor, my wife's brothers are doctors. So I said I have to get out of this rut and I'll go crazy if I keep only discussing medicine. I love medicine. I'm passionate about medicine. But हर चीज की एक हद होती है. And हर चीज, everything has to be in moderation. Moderation is the buzzword in today's modern times. So I think Rotary gives you that opportunity to meet people from different vocations, understand what is happening, and gives you opportunities to go and speak for your profession, for yourself, and see the world also. There are opportunities in Rotaries to travel. There are friendship exchange programs. So it's an unlimited thing. And nowadays, Rotary, earlier they used to meet once a week. Now there are only 2 meetings a month. And the meetings are only 20 minutes. You have to go only for 20 minutes. And you can walk out if the meeting lasts beyond 20 minutes. The rule is you can walk out. Sorry, I have to go. And you don't have to, if you like the speaker, you can stay on. Otherwise, you just quietly move away. You don't even have to apologize or anything. So 20 minutes is nothing.
Right.
Absolutely nothing.
Right. So you talked about, when you talked about Operation Restore and seeing patients in the middle of the night, you said you need to have a good team. And I have been visiting NBC for the past 15, 20 years or so. And there is one thing which I notice every time, that you have the same team since over more than past 15 years or so. And in this era of high turnover, when not many people prefer to stick on to a single place, how have you managed to maintain the same team with the same level of commitment, with the same level of interest in the work over the years? I mean, what keeps them motivated as such?
I think, Nikhil, I've done good karma. I've been singularly fortunate to get people who like me and my leadership. I think there's a lot of leadership. I'm the director of the hospital, and having worked in the army, I've been having passed out from the Armed Forces Medical College. Some amount of leadership skills, I kind of imbibed. It was not really taught to us, it kind of imbibed, wherein I generally try to lead from the front. I don't order people around. I said, chalo, hum ye karte hain. And then I'm always there. So the first 15 skin donation calls, in the middle of the night, I took my own car with my own instrument, with my own Humvee's knife, picked up the team I walked from Chembur, took the car in from Chembur to Airoli, which is about 30 minutes away, picked up the team, went all the way up to Lonavala to Harvest, and then had fun on the way. Vada pav khaya, chalo ye khate, wo khate. Make it like a picnic. And again came back and periodically appreciate them.
Right.
Felicitate them. I make it a point to take my team members by rotation for conferences, make them present a paper. They may not be great, but they present, their self-worth goes up. Me conference la gelo hoto. In national Delhi la mala bolawla hota. Just imagine the people in my team who didn't have a passport, and they went and two of my RMOs, 10 RMOs, went to Netherlands. They didn't even speak proper English. We coached them up. We gave them presentations about India to talk about India when they go there. Coached them up, briefed them, and they brought the technology here. 1 month training ke baad. Now they are very senior members of my team out here. They are administrative officers here. So every one of them has seen a self-growth, and emoluments are also going pari passu. If the hospital does well, we see to it that they get regular increments, adequate increments, and there's something called loyalty bonus, which we have, where if you stay beyond 5 years, the increments are double of the regular people.
Oh, is it?
So it's nice to retain trend. Yes.
Absolutely.
Because and they travel with me.
Yeah, in a field like burns, it takes so much of more time and efforts to keep on training new people. And if you have already a trained set, the outcomes too tend to go up.
Yeah, the loss of a trained person is a big loss, Nikhil, as you rightly said. Training involves a lot. It takes a lot of time. It's a life-saving thing. Plus, when we train, we don't allow them to directly, independently look after the patient without a mentor. So once they become mentors, we don't want them to leave. So whether it's a nurse or a doctor or a physiotherapist, once they're with us beyond 5 years, their increments are double. They attend even international meetings with us.
Right.
So they travel by the same flight in the same class and stay at the same hotel. Abhi isse aur zyada, how many people do that? How many institutions do that?
I know. Absolutely,
And
absolutely.
it's a small family. It's a small family also. It's like a family. So it's not a very big hospital. We are a 50-bedded facility and totally about 67 staff members. So it's not a very big family. So we know the names of everyone individually. We know what's happening in their family. And they consider
Mm.
us as their family and I consider them as our family. So we help each other with personal problems. So so we look into it. So when there's a family kind of situation, then they normally don't. There's a comfort level which is established. They will never get anywhere else.
I
जब
know.
भी leave चाहिए उनको leave देता हूँ. I give them leave whenever they want, as often as they want. So long as they can justify it, and we have enough number of people to compensate for the absences. So I always keep 2 extra people then required in any particular department. तो किसको leave चाहिए? It doesn't hurt us to give leave. There are enough 2 extra in each department. That is the key.
Right, sir. That's really interesting. Now, your father, Dr. Manor Keswani, sir, he was a pioneer burn surgeon. He gave us the dictum pour water on burns, which we tend to follow, tend to propagate each and every time. So, how easy or how difficult was you to fill in those shoes, which were, I would say, enormous shoes in the field of burns? Was it a natural evolution, or were you forced to come into burns, or you came by choice, or was it a mixture of both?
No, let me confess, Nikhil, I didn't come into burns by choice. No, I didn't. In fact, when I passed my plastic surgery, I told my dad that burns I will not do. My focus is cosmetic surgery. I went for 2 or 3 fellowships. I was practicing exclusive cosmetic surgery and hand surgery and trauma, because initially trauma hi aata hai tumhare paas when you start practice. So I was fixing mandibles, I was fixing maxilla, I was doing tendon repairs, I was fixing little phalanges fracture, putting K wires, treating diabetic field, doing small fluttering pressure sores, and cosmetic surgery. Focus was on cosmetic. I was attending all the cosmetic surgery conferences. I didn't become a member of the National Academy of Burns for a long time. And I didn't attend burn conferences except one which my father used to organize only to help him out because he was getting old. He said, "You have to help me." I said, "Help you, Dad, but don't expect me to follow any." He said, "No, that's okay. You help me whenever I do something, you help me." I used to go and assist him for surgery, but I never used to visit the Burns Hospital also. We started in 2002. It's only in 2005 when he got a stroke. My dad got a stroke and he lost his speech and lost the use of his right side. That I felt sorry for him, and it was his dream was not by 2004. Still, hardly 1 or 2 patients used to get admitted. There was no station, there was no bridge, there was no road outside the hospital, there was no lights, and we did not have enough equipment. We did not have the ICU still. We just started because the funding got over. And that point in time, my grandmother called me, "Ke, your father had a dream." My mother had passed away by then, and she said, why don't you help him out?" So I spoke. When I say I spoke to my father by sign, I spoke to him, but he answered by sign language. He could not speak. He lost his speech. I told him, "Dad, I'll come half a day just to help you out to keep the thing afloat till you find somebody else. And after day, I'll still continue to. Majority of my time will be for cosmetic surgery." He had no choice. He had to accept that. And as I went all along, I felt more and more involved. I felt that yes, I can do it. Things started working my way. I needed money. I took the help of Rotary. I had no choice but to take help of Rotary. And our library is being built by Rotary. Our physiotherapy department is built by Rotary. Our ambulances are given by everything by Rotary. There was no money. And initially, patients were also not coming. Initially, the poor patients come. The poor patients came. They didn't have any money. We had to fund them. So, and then as things went along, the work increased. We started getting recognition as a burn surgeon. We started one bank. Then we learned the ropes how to set up a bank. Then somebody from Pune suggested, can you set up a bank? We came to Pune and set up a bank in Surya Hospital. And as we went along, I got more and more involved. Then I started learning critical care. I read up everything about critical care generally, started attending meetings. And when I found that, yes, I'm better than others, then I had the bigger place and then I can say what others cannot. And I said, yeah, this sounds interesting. I am able to do it. Little bit money also started coming in. So gradually, I realized that I have to put in full-time work for a couple of years. And then maybe it will be on auto mode. So for some time, for almost 8 years, I stopped my cosmetic surgery practice. I stopped going to other hospitals to make this functionally viable. So from the year 2005 to 2012, I did not go to any other hospital. I stopped everything. And only in 2016, I started my cosmetic surgery practice. And then with my son, Dr. Siddharth, joining me 5 years ago, I have started full-time cosmetic surgery practice.
Oh, that's
so it's not easy. I didn't come in by choice. No, I didn't. Confess.
And you belong to the rare lineage of plastic surgeons wherein there are 3 generations of plastic surgeons. Now that Siddharth is also a plastic surgeon, is he compulsorily into burns or is he by choice into burns? Or he is not into burns?
No, he is very much into burns by choice, but he like me says, Dad, I can't do full day burns. So half a day he's working for does cosmetic surgery outside. He goes and assists sometimes Dr. Milind Wag, sometimes Dr. Varun Dikshit. He works almost full time half a day with Dr. Sitaram Prasad for reconstructive surgery, for trauma, for hand surgery, for microvascular surgery. And he says, I love doing burns, but it cannot be full time. Because burns में there's not too much variety, Nikhil. You know, there's not too much variety. He says, after having studying so much, Dad, is it really fair that I be doing only this? I am capable of doing so many things. Why should I restrict myself? I said, better till I am there, you can do all that. But then you have to build up a team so that that team substitutes for me and then you can do both. It is possible, doable. Now that you have a platform, it should be possible for you to do it. And so as a rule, from 9 to 1, he is here at the Burns Hospital, while I'm at Breach Candy and Chembur. And then 1 to 7 is with Dr. Sitaram Prasad at Zen Hospital in Chembur. So he has the satisfaction of doing both.
Right, sir.
You're absolutely right. Alone burns nobody can do and nobody should do because there's a lot of burnout. So even the staff members, we rotate them from the OT to the ICU, ICU to the OT every 3 months. So everybody in the hospital knows about everything. In the times of a disaster, suppose 20 patients, like last night, 9 patients have come in. So there's the ICU nurse has worked in the OT, so she knows how to do the dress. The OT nurse has worked in the ICU, so she knows how the central line is put, how the arterial line is put. Usko bolega trolley banao arterial line ka, she can make it. So everybody knows everything about everything. So the rotation helps reduce the burnout. Also, it makes everybody ready for disaster.
Right. That was actually the next thing I was going to ask you, because burns is something which is a high burnout type of an entity. Seeing the patient suffering, even surgeons as well as the nursing staff tends to get burnout. But I think this is a very nice thing, which unfortunately in the public sector hospitals, we are not able to replicate. But I think wherever possible, it is a good thing to do. Now you did, or rather are doing cosmetic surgery along with burns. Even Siddharth is doing the same. But talking for you personally, if you look back over the years and give it a thought, do you think you might have been more satisfied, more happier if you had taken a different trajectory at that point of time without going into burns, venturing fully into cosmetic surgery?
No, Nikhil, because cosmetic surgery is exciting, but the patients are definitely more demanding. The burn patients are easy to satisfy. They survive and the relatives are quite happy. The stress in cosmetic surgery is fairly high. Money is big. But then beyond the point, you don't need that kind of money. Beyond that point, you need the satisfaction of giving back something to society, and the satisfaction of saving lives, and the satisfaction of wiping the tear out of somebody's face, or making somebody smile, or bring the smile back to somebody's face by getting a deformity all right, or by bringing smile to somebody's face by getting him a job. Now that satisfaction has no substitute and no replacement, which I would never have got from cosmetic surgery. So looking back, I think given a chance, I would repeat the same thing again. balancing out cosmetic surgery with burn. Ideal combination, पैसा भी मिलता है और प्यार भी मिलता है. इस पैसा या प्यार नहीं है, पैसा और प्यार दोनों
और
मिलता है.
प्यार दोनों है. Yes.
दोनों है.
We talked about coping strategies for mainly the nursing staff. You said you shift them from OT to the ward and ICU. This keeps on going. But what about the emotional burden of surgeons? You, for example, how do you cope up? Because the staff might change, but you personally have to look after the patients. You tend to have to look, you have to talk to the relatives as well. You need to explain to them, you have to counsel about death. And this is a fairly common thing in burns. So how do you manage the emotional trauma and burden on?
Now every surgeon has to have diversions. He has to have distractions. He has to have hobbies. He has to have certain passions. Like for me, the passions are one, I love teaching. So I love reading and traveling and giving talks here and there. You know how many times I have invited myself over to BJ Medical College. Nikhil, मैं आ रहा हूँ कुछ, and then you realize I want to come and speak a little bit. आगे मैं बात करता हूँ. Many times I call up Rajesh Pawar when I go to Kolhapur with my wife. Rajesh, मैं आ रहा हूँ. तो सर आप आ रहे तो एक छोटा talk दे दो. So same thing happened. Command Hospital, Dr. Dev Sharma said, "आप पुणे आ रहे हैं और my daughter's delivery, son's delivery, son-in-law, daughter-in-law's delivery, तो उधर एक talk दे दो, एक symposium में participate करो." And the passion is to read before giving the talk. The fun is to prepare the talk. So never I give the same talk again. उसमें बहुत मजा आता है. So that passion is one. Two, the passion of calligraphy. I do calligraphy. So I have about 45-50 types of pens I keep doing. Third is music. I whistle on stage with orchestra, whistle on stage with karaoke. I know most of the songs. I hum songs. So every morning I get up. You won't believe it, Nikhil. First 20 minutes, first after getting up, is ironing my clothes for the day and for the next few days with the music in my earpods and 3-4 songs ke back tracks unke, I whistle along with it. That becomes part of my pranayam. And then I do a 1 hour of reading. Half an hour will be medical reading, half an hour non-medical reading. And then 1 hour of walk. Then you might wonder, ye sab kaise hote? Because I get up early. I get up at 4. And that's when my day starts. But then you might ask, agar 4 baje to sota kabhi hai? I sleep by 8:30. Now people find it difficult. But when you get up at 4, automatically you sleepy by 7:30. And then walk karne ke baad play 45 minutes of table tennis. And then I leave by about 8:30. So I have a full day. I have enough me time for myself. There is no television which I watch. I don't read newspaper. That comes on my, whatever news is important comes on my phone. I've got subscriptions. And I think ultimately it's a question of time management. So people ask me, how do you manage your time? I said the best thing for time management is overburden yourself with more tasks than you think you can accomplish. If you think you can accomplish 7 tasks, put 12 tasks on your agenda or to-do list for that day, and time will manage itself. Automatically, you'll wean off what is not priority and automatically do what is priority. So always overburden yourself with tasks for the day and live from day to day, audit each day and have a little vision for the future, but essentially work for the day. Don't think much about the past and don't fret or worry too much about the future. I've never been worried. I sleep within 10 seconds on sleeping, however critical my patients are. My wife asks me, Vandana, she's an anesthetist, how can you sleep when so many patients are critical? Aren't you worried? I said, I am. I am worried. I'm not worried. I'm concerned. But I put in my 110% when I was awake the whole day. I have assistants who have been told what to do in case of what. There's an algorithm and a protocol and SOP in place. They know exactly what to do. And so I sleep peacefully. Yes, I've done my bit.
Right, absolutely. So keeping ourselves busy is the key.
Absolutely. Man was born to work, Nikhil. Man was born to work, and work will keep you sane. Work will keep you alive. Work will give you longevity. So my typical role model is not a plastic surgeon, but a physician called Dr. Farooq Udwadia, who at the age of 96 at Bridge Candy Hospital, he's a pioneer of critical care medicine. 96, he walks in every morning at 8:45 at Bridge Candy ka lobby mein. You can set your watch by his walking in. And works till 5:30 every evening, come what me Monday to Friday, and has all the time in the world to write poetry, to write books, to enact plays. He's a playwright. And at the age of 96, I met him last month and he says, Sunil, I'm writing my next book. That means he expects to live beyond 100. Each book takes 2 years. That means 98 tak to he is expected to live. And he walks 5 floors of Bridge Candy Hospital every day, 5 times a day. He almost curse him कि sir lift नहीं लेते हम लोग लटक जाते हैं. I mean, that guy is something, and gives beautiful lectures even now, completely sane. You have heard him. You were there when he came and kind of released your book on MCQs in Burns, which is a fantastic book that you have created. I think that book needs a little more marketing. More people should buy it. I have distributed lots of copies of that book. So if Dr. Farooq at 96 has the spring in his step, a smile on his face, and a song on his lips every morning, who am I? I can definitely aspire to do it. I may not succeed, but कोशिश करने वाले की कभी हार नहीं होती.
Right, absolutely. Now we talked about a bit of flashback, and I asked you specifically whether you would have changed tracks from burns to cosmetic early on. That was about the work part of it. But apart from that, you have never been in leadership roles for the Association of Plastic Surgeons of India or the NABI, being very instrumental in all these associations, being a great leader. There are so many people who look up to you. So any thoughts about that? You didn't feel like doing it, or any specific thoughts about it?
Nikhil, the reason was not that I didn't feel like doing it or I don't want to do it, but the thing was, setting up the Burns Hospital was such a task. It did not leave me any time at all. It's only in the last 5 years that the hospital is on stable platform, stable ground. I really did not have any time. We were setting up each department. When we started, there was no ICU. ICU was built in 2009. Hospital started in 2002. Skin bank started in 2009 July. ICU started 2009 December. Then we started step down ICU. We had only one operation theatre. Every year we added one operation. Today we have 6 operation theatre. So every year I took up 2 projects to set up a different facility. Then we set up lasers recently. We have a CO2 laser, a diode laser, and a Q-switch NDAG laser. Then we set up a skills lab. So every year I've been working extremely hard to set up a certain deficiency in a burn center so that we have all the facilities under one roof, and it could be a model for anybody else to replicate in India, because this is the Indian population. Essentially, I had no time. So, and taking up a post is a lot of responsibility. Once you take it up, you can't say मेरे पास time नहीं है. And burns is such a field, suddenly 20 patients आ जाते, 10 patients आ जाते, and it's really difficult. It's only now that my son has joined me and that I have a little more time, a little more free. Morning time, I have a little time. The morning se raat tak I used to be busy. So I think now maybe, and now I think you can always support from outside. I don't have to be. There are always people who are fighting elections to become. There are a lot of aspirants for this role. So you can have a leadership role and a mentorship role, even standing on the sidelines, which I think I'm attempting to do. A lot of people come to us for observerships, for fellowships. We even had a doctor, plastic surgeon, come from John Hopkins for a 3 weeks fellowship program. Right now, we have a young doctor for the MCH plastic surgery, passed from Sion Hospital, who's with us. We have nurses who come for critical chemistry, 8 nursing colleges, 6 physiotherapy colleges. I constantly do training programs for them. We have a team here. So I think I have very little time to take up these leadership roles. But yes, as an advisor, as a mentor, whenever they need help from outside, I definitely love to help. I keep giving unsolicited advice to our present president, even Sujata Sarabhai, caller up, Suja, why not? Let's do it this way. Let's do that. And somehow I've been very fortunate that we have good rapport with most people. And Sujata agrees to most of them. Smita Segu is another friend. I keep seeing one of the future presidents. They help out. They listen to what I say and what they do. Some of it we do brainstorming. It's when I can't order them, but I definitely suggest. And ke aisa karte to kaisa hota? Why don't we try this? And we have been making a lot of subtle changes in the field of burns teaching, in the field of the kind of talks and lectures at conference, and the kind of workshops we offer at these conferences.
Right, absolutely true, sir. And every year you have been upgrading the National Burn Center in some or the other way. In spite of doing all these things, and in spite of doing regular awareness programs over the years, collaborating with Rotary, you have also been doing some amount of research work at the National Burn Center. So can you talk something about research, and especially a few tips, tricks for the younger generation for research in burns, especially when the environment is resource limited?
Nikhil, we have a skin regeneration laboratory where we
Yes.
make our own keratinocytes, fibroblasts, melanocytes. We have been using the keratinocytes for hastening healing at the donor side as well as at the recipient side. In widely meshed grafts, we put keratinocyte spray. We have started a clinical trials last 6 months. The ethics committee approval took a long time. We've even used cadaveric skin to make our own acellular dermis, which we have been using again for last 6 months. Hopefully, we should be able to market this in about a year and a half's time, both these things. The keratinocyte, the allogenic spray and the autologous spray. We have got everything ready. In fact, there's a paper being presented at the next NABICon in Delhi in end of February on this keratinocyte spray. Our research officers are presenting it for the first time. And now we are embarking on 3D bioprinting along with a company called High Media and a Hyderabad-based company which has made 3D bioprinters. And the sky is the limit. Funding, what we have done is 2% of whatever the hospital income is, I diverted to research. So we don't look for external funding. So luckily, I'm in a vantage position where I'm the clinician and the administrator and the trustee. There are other 9 trustees who are not doctors. They're quite happy with the progress of the hospital. So in medical things, they don't interfere with me. But as financial things, they question me, ki itna kharcha kaise kiya, which I explained to them. They're quite happy with it because they've seen the hospital grow from where to where. So funding comes easily, and even a lot of funds, we are in collaboration with IIT Bombay, we are in collaboration with IIT Kharagpur, we are in collaboration with ICT, Institute of Chemical Technology for scaffolds. So I think funding is available and it's not difficult and it's very exciting. Like it's one of the divergence for me to, it's very exciting to make your own composite grafts. Like one of my other role models, a lady called Dr. Fiona Woods, who has made this ReCell spray of keratinocytes. She's a phenomenal lady. If anybody gets a chance, you must please Google her name on Wikipedia and read what all she has achieved after the Bali fire bombings. And research is a fantastic field, and it is exciting, challenging, at the same time satisfying. So it gives you a lot of satisfaction to set up a team. You will be the clinical part. You will set up a few clinicians, biotechnologists, PhDs and non-PhDs, will help you with the research, and research will take Indian burns management a long way. Indigenous research, because the foreign research has been done, but it comes at a cost. The ReCell spray of Fiona Woods is very expensive, beyond our reach. Yeah. So gradually, hopefully in a year and a half time, mark my words, by 2028, we'll be marketing our spray at very nominal rates or even free to poor patients like we do for skin. And we'll share the technology with everyone like we shared the technology for skin banking. It is not my personal property to keep. We will share. We don't want to make money on these things. We are not a commercial organization or a commercial thinking.
That would be absolutely game-changing, sir.
Yeah.
Now, I have visited NBC multiple times and I have seen you gift books. You yourself are a voracious reader to all those who visit NBC, either for restore or giving talks or in some or the other way. So as a voracious reader who has kept on reading over the years, what 2 to 3 books would you recommend, your all-time favorites, which everyone should read?
See, one book which really inspired me was a book on the Mayo Clinic. It's called The Brothers Mayo. It is William and Charles Mayo. How they set up the hospital is it is something like the kind of Ganga hospital that these two brothers, Raja Sabapati and Raj Shekharan, have built up. Their book, Ganga, the story written by the mother, is another very inspiring book, which makes you work hard. From a 10-bedded facility, Raja Sabapati and his brother have built this huge, colossal training center where people from all over the world come and train. Isn't that an inspiration? Isn't that something we're really proud of? So books like these, then there's books by called Light from Many Lamps. It's a book by Lillian Eichler Watson, which has very inspiring poems, very inspiring excerpts of speeches, and many quotations related to that. So there are different topics on that. I've read that book not less than 50, 60 times. I must have distributed about more than 5,000 copies of that book in the last 25 years. So that is a book, I order another 50 and I give it away free. My wife thinks I'm wacko. Why do you give away books free? I said, because I feel that if someone can benefit and get motivated by reading a few words, I have saved a life. I've retained the passion or spark in somebody's life. So I think that is the thing that, and then of course I read anything and everything under the earth, because every morning, half an hour I have to read non-medical and half an hour I have to either see a YouTube medical video or read something medical. Because the quotation of George Bernard Shaw had inspired me. He said that George Bernard Shaw said, I do not think much of a man who's not better today than yesterday and who's not better tomorrow than today. So we have to be better by one fact, one idea, one thought. So we have to get better and better every day. And it's by taking these small baby steps, as they say, that you reach your goal. Again, your goals have to be clear. Again, as students, younger students, I must tell them, don't work hard, very hard without a goal. Because there was a quotation which I read which said, I don't know where I'm going, but I'm surely on my way. He's running fast, running very hard, working, but in the wrong direction. As I said, now even if you sit in a taxi wala puchega, bhai sahab kahan jaane ka? So you have to tell him, na? You tell him, nahi, jaldi chalo, jaldi, meko jaldi jana hai. Oh, bhai sahab, bataiye kahan jana hai? VT jana hai, Churchgate jana hai, Dahisar jana hai, which direction? So the sense of direction is very important. So your goals have to be crystal clear. You may keep changing your goals. You may keep redefining your goals with passage of time, depending upon what kind of thing you get. But you have to have a purpose. You have to have short-term goals. You have to have daily to-do lists. You must audit on a regular basis what you are doing. I audit myself. I have a notebook where I write my to-do, which at the end of the week, I see मैं कितना किया, कितना नहीं किया. And you have to be very objective about it. I mean, my wife finds it very strange. When I sit with a newspaper, I sit with a highlighter and a scissor. So she says, who reads newspaper with highlighter and scissor? I don't read newspapers, but when I do, I sit with that. To do interesting article, cut karke, bring it to the hospital, laminate it, put it up on the notice board. I have 15 notice boards. So when I have something I love to share, I said, my reading should help somebody else. Then we run a group called Bibliophiles, where I share the books which I read and others share the books that they read. Then there's another group called Bookworms, which Dr. Sheeja Rajan introduced me to. Yes. Is another bookworm group where you learn something. So I think people like Steve Jobs, Warren Buffett, they say just one thing. Everyone must read, must read. Because reading is the only way to get... Elon Musk, all these guys are readers. Steve Jobs gives you a recommendation of books every 3 months. Warren Buffett reads every day. So if these guys have to read, हम किस खेत की मूली, हमको भी पढ़ना चाहिए. And I always believe when people say, how do you find the time? I said, when you desperately desire to do something, you will find the time.
Right. So that was a very nice and interesting piece of advice. Now coming to my last question, sir. Now, what would be the top 2 or 3 advices which you would give to the younger generation? Or what do you think you would have been benefited if you had got these advices in the prime of your youth? I mean, something you missed on, something you would like to do differently. I mean, the benefit for the younger generation.
Yeah, I have a couple of regrets. What are those regrets which are? Some things which I went wrong. When I started practice, I started running about right from the beginning. I went to many hospitals, many places, many clinics, searching for work. That you should not do. You should focus on couple of 2-3 places and work will come to you. So I think that don't run around too much. You must have time to upgrade yourself in knowledge. You must balance, work-life balance has to be there. So my regret is that I didn't spend enough time with my kids. I was working too hard. And it would have not made any difference if I had treated 10 patients less or 15 patients less. But I would have seen my children grow. So hopefully now I have grandchildren. I'm looking forward to looking after them. And sometimes my son tells me, Dad, I want to be a good father, insinuating that I was not a very good one. I want to have work-life balance. So I don't grudge him that because I was a terrible father. I hardly saw them. I used to leave home at 7 and come back at 12. And Sundays was Rotary or IMA. I was trying to network and market myself. There is one regret that is there. But advice which I'd like to give the juniors is focus on work. Try to excel. Don't compromise. Don't, जैसे Vivekanand bola, arise awake, don't stop till the goal is reached. Follow Vivekanand's aphorism. Don't stop till the goal is reached. And you have to have the passion. So do what ignites your spark. Without that spark of passion, the drive will not come. You have to have the drive. And remember, don't go after money. Money is a byproduct of good work. Work will come when you are excel. People will refer work to nahi. The so and so is good at something. उसके पास refer करो. अच्छा काम करता है. वो charge भी बहुत ज़्यादा नहीं करता. काम भी अच्छा करता है. And results उसके अच्छे हैं. So I think work hard, excel in whatever you do. Have very clear goals. Excellence should be your target. Money will come. Because unfortunately, the younger generation, seeing their counterparts who are engineers earning 5-figure salary at the age of 24, and a plastic surgeon earns that kind of money only by the age of 40,
Yes.
and you pass out only by 35, that makes you greedy and you don't have a car. He's driving a Audi or a BMW. You barely have got a second-hand i10 or i20.
Right.
And that makes you want to go and get into the race by focusing on money. Paisa kidhar. No, don't lose the spark, because if you don't have the spark, go after the passion or spark, your rest of your life will become very boring and life will become drudgery. You have to enjoy your work, and then, as they say, if you enjoy your work, you don't have to work at all.
Absolutely, sir. That there is another sentence which about work-life balance is like, for some people, work is their life, so there is no need of work-life balance. If you are enjoying your work, you are already in balance.
Correct. So that the youngsters have to understand. They should not run after money. Money is important. Absolutely. I agree with them. The money is important, but money is a byproduct of it. Work well, work hard, excel, and money will come. There is no way money cannot come to you. And plastic surgery is such a branch where you can really excel. You can focus on a small aspect of life. You can either do lymphedema, you can either do burns, you can do AV fistulas, you can do cleft lips. Focus on something. Of course, do everything, but focus on something. So get well known in a particular niche area where you are branded as, ये काम अच्छा करता है. ऐसा केस है तो इसके पास भेजो. You know, and when your peers refer work to you, that is the ultimate acid test you have made it. Peers referring work to you, it's not easy for them to refer. They would like to do it themselves. But when they refer a patient to you, like I got a patient from Ahmedabad last night, from Himanshu Vora and Dr. Bhatia. Now, that is, you feel good about it. That means they accept you, they think you are really good. And the peer review is the biggest review and the biggest reward. You feel great when some fellow plastic surgeon refers a patient to you. And the responsibility also, but the thrill is great. It reinforces. And the thrill doesn't stop, however old. I'm 67 years old, but I feel 16 years young. Every morning I get up with a spring in my step. I got tons to do. I got lots to do. The excitement in my voice. And sometimes patients say, "Doctor, how are you so excited and happy all the time?" I said, because I have lots to do. And work is what keeps you happy. If you have lots to do, you have something to look forward to. If you start your day और कुछ करने को नहीं है तुम्हारे पास, trust me, you'll be depressed, you'll be dukhi. Here I have trust tense. Like tomorrow morning, we are going to Sion Hospital and Masturba Hospital. Two Rotary clubs want to donate money. We're donating 30 to 40 lakhs to each burn unit. I said, I don't need the fund. Let's give it to them. Let's upgrade them. Remember, I had offered you also. You said, but unless I get the staff, there's no point in upgrading. So they're giving 40 lakhs to each. And I spoke to Kasturba. They said, no, we don't have a good boils machine. So I get a thrill out of providing a boils machine to a public hospital where we all passed out. And people run down public hospitals. I get very angry. I said, public hospitals are where we work and we were molded. Public hospitals are great places. Unfortunately, they are understaffed, overworked. That's why you don't get the outcomes. Other people in public hospitals work 10 times harder than people in corporate hospitals.
Right. Absolutely, sir. So it was a very interesting conversation. I enjoyed. We have talked on multiple occasions, but this was special. This will go for posterity as well. And thank you so much. I look forward to meeting you in person in one of your next visits to Pune and also visiting National Burn Center. Thanks a lot, sir.
Thank you so much, Nikhil. Thank you so much.